I do think that it's very helpful to have a neurologist as part of the team that's taking care of these patients. At our institution, the neurologists do a baseline exam just to become familiar with the patient, what the patient's neurologic history is there any prior history of seizures, and then also I think to do some education, and this could be done by any clinician on the team. And we follow the patients if they do develop neurotoxicity in the hospital. Some patients are treated in the outpatient setting, and then they come and see a provider every day. And if they were to develop a seizure or neurologic symptoms, then they're admitted. Certainly seizures can develop, and movement disorders and weakness, so I think it's important to have a neurologist who at least is starting to see these patients and becomes familiar. There's a lot of pattern recognition, and you become more comfortable. It's nice to have someone to turn to help with this. Certainly with the seizure management, the neurologist can be very helpful for that as well. But again, I think that what we've found to be very helpful is just having a group of what we call CAR-T super users. So a close-knit team maybe involves someone from the intensive care unit, nursing, the providers who are seeing the patient on a daily basis that really have, they're able to work together as a group and make each other aware if there are questions or concerns about the patient. And of course also education as well. So we found that that's very helpful, and now really if you do that, then it becomes a much more routine process and you become more comfortable guiding the patient through the process should there be any toxicity.